So I'm here today to get a platelet-rich plasma injection. This is for chronic tendonitis of my knee. So it's got tears in the ligament in my knee. So what they're going to do is first they're going to take my blood, then we'll be centrifuging it to split the different layers, and then it's going to be injected directly into the tendon. So now the nurse is taking my blood. The reason we're using my blood is because that way we don't have to worry about blood grouping, as well as it reduces the risk of infection from using somebody else's blood. So it's much better if you can use your own blood in any of these circumstances.
Oh, it's pretty good.
Okay, so we've got the tube of blood here. We're now going to centrifuge it to split it into the layers. So this is the blood after it's been spun. You can see that the red blood cells are on the bottom. The centrifugation separates by size. So the red blood cells being the biggest go to the bottom. The white blood cells sit in a layer on that, and there's not very many white blood cells to red blood cells, so you can't really see it. We then have a gel that's part of the test tube already and helps in the separation process. Then the plasma, the straw-coloured fluid at the top, which carries everything, and at the bottom of that plasma are the platelets, and again you can't see them because they're that small, but they sit at the bottom there, and that's what the doc's going to take off now and inject into my knee. So the doc's now injecting that plasma with the platelets in it into the tendon. So he's using an ultrasound machine which uses high frequency sound, which bounces off the different soft tissue, and different types of soft tissue have a different resonance, so it comes up on the screen and it looks a bit like a shadow, but the doc can actually see where the holes in the tendon are, and if you look closely you can also see the plasma going in, and as it pushes the fibres of the tendon apart. So what he's doing is putting it into the tendon, injecting a little bit in, looking for the holes, then pulling it out and putting it in again in another position. So jiggling the needle around to get as much of the platelets in to the problem parts of the tendon. This will cause inflammation response, so you'll be hobbling around for the next couple of weeks, but that inflammation will actually heal the tendon. The problem with tendons is that they don't have a high blood flow, and because they don't naturally get that blood flow, they don't heal very well by themselves, which is why this procedure is necessary.